Hey everybody, I'm Brittany. I'm a volunteer for the CRPS Warriors Foundation, and you all know that I am a full-time caregiver for a CRPS warrior. Caregiving can be really tough sometimes, so the next couple days we're going to talk about how we can stay calm and stay positive while meeting the challenges of caregiving. So I'm going to tell you about the last 2 weeks that I have experienced in caregiving. Brian has hernias. He's had them for over a year. The past 2 weeks, though, it has been a drastic and severe change. And it has completely depleted his quality of life on a daily basis. In the past 2 weeks, I had to fight with a nurse for 4 days to get his pain medication refilled when he's in extra pain, and it's also the one that will cause the extra pain because it will send him in withdrawal if he misses too many doses. So then we had an appointment with the PCP, which she's great. She felt around and she said she thinks there's more than the 2 hernias that we knew about. And she wants to refer him for surgery. And that we were going to refer to Pittsburgh because we aren't having any luck with doctors in Erie. So the next day we get a call from a surgeon in Erie. The same surgeon that had denied Brian surgery for this last summer. So I had to call the doctor back and say, hey, I'm just confused because we talked about going to Pittsburgh, and I get a call from the surgeon in Erie, and she said, well, I'm really sorry about that because that's a clerical issue because the paperwork clearly said refer to Pittsburgh, not Erie. And this was the same nurse that I had a problem with the prescription that did this with the referral. After that, Brian has to get imaging done for his pain management doctor. So he goes over to Greenville Hospital. They won't do it because they can't find the order. These are things that are frustrating to anybody. To have this happen to you for 10 years over the same condition, this is why he doesn't fight for himself and advocate for himself anymore. And he's been dealing with this for so long that when this starts to happen, he just is defeated and that's it. He's done. But for me, I want him to have the medical care that he needs. So I will fight for it. And I will fight with whoever I need to get what he needs done. The last 2 weeks of mine has been consistently fighting with medical staff over properly treating and medicating Brian. Most of the time I try to handle this kind of stuff and then I'll tell him about it after it's already fixed, because then he can get upset that it happened, but he's over it because it's fixed. My big thing every day is how are we going to reduce Brian's stress? Stress is a no-no because it will send him straight up. It'll skyrocket that pain that he's got going. If you're a caregiver and you're experiencing this, if you're overwhelmed, if you're upset, that's okay too. All I can say is please be educated, because the more educated you are, the better you are off to fight for your warrior. I try to educate myself as much as possible because then the doctors and this nursing staff that do this stuff don't know how to take me because I do know what I'm talking about. So then they correct the problem. I'm not doing it to be mean. I'm doing it because I want fair treatment for my boyfriend. And I know what that is. I'm just going to tell you today the biggest one that really helps me calm myself in a situation. In the next couple videos, we'll go over some more things that I do and some more things you can do. The biggest one for me is music and fresh air. Put your headphones in, go outside, take some deep breaths, jam out to your favorite song. It helps me calm down and center myself so I can be where I need to be. And I want every caregiver out there to know you're important, and this can be hard, but don't think that you can't do it. And don't feel like you have to call that doctor or that place back today. You need to be in the right mindset, and you need to educate yourself so that you know what you're talking about. If you're educated and they know you know what you're talking about, the more likely you will be able to get what your warrior needs. So take that night and educate yourself, brush up on it, get your mindset where it needs to be. Next morning, call them and get it done. It's okay. It's overwhelming. It's normal, and we will get through it together. And